Hello, I'm Jonathan Kay, reporting for Room Now at ACR Convergence 2021, which was to have taken place in San Francisco. One of the highlights of this year's ACR Convergence is the presentation of data from Pfizer's oral surveillance study, which was a phase 3b, phase 4 randomized safety study that compared tofacitinib to the TNF inhibitors adalimumab and etanercept in RA patients aged 50 or older who had at least one additional cardiovascular risk factor. Today, in abstract 1940, Jeff Curtis presented data from this study indicating that incidence rates for all malignancies, excluding non-melanoma skin cancers, were numerically higher for both tofacitinib 5 milligrams and 10 milligrams daily than for the TNF inhibitors. The hazard ratio for all malignancies, again excluding non-melanoma skin cancers, was significantly greater for tofacitinib versus TNF inhibitors at 1.5. Older age, 65 or greater, and current or past smoking were independent risk factors that increased the malignancy rate across treatments. However, without a control group not treated with either tofacitinib or TNF inhibitors, one cannot distinguish between an effect of tofacitinib increasing malignancy risk or of TNF inhibitors decreasing the risk of malignancy. So, what might be a biological basis for tofacitinib increasing the occurrence of malignancy in RA patients? Pyroxenase 1 is an enzyme secreted by the liver that associates with HDL cholesterol and hydrolyzes a wide variety of substrates. As such, it has several different enzymatic activities, including pyroxenase, lactinase, and arylesterase. Pyroxenase 1 contributes to the antioxidant and anti-inflammatory properties of HDL cholesterol. This enzyme is encoded by the PON1 gene, polymorphisms of which at the Q192R allele have been associated with a reduced risk of malignancies. Ian McGuinness has previously shown that tofacitinib increases pyroxenase activity. On Sunday, in abstract 980, Christina Charles-Schoeman presented results of a study that investigated the relationship between PON1 genotype, pyroxenase 1 activity, and risk of malignancy in nearly 2,000 RA patients who participated in the phase 2 and phase 3 development program for tofacitinib. Among these patients, 53 developed malignancies. Comparing the RR PON1 genotype to the QQ genotype, pyroxenase activity was increased, and both lactinase and arylesterase activity were decreased. After controlling for baseline risk factors associated with malignancies, including tofacitinib dose, age, smoking, and RA duration, higher pyroxenase activity over time was associated with a lower malignancy risk in RA patients treated with tofacitinib during the phase 2 and phase 3 development program. However, no association was observed for either lactinase or arylesterase activity and risk of malignancies. This is consistent with the observed reduced risk of malignancies that has been associated with PON1 gene polymorphisms at the Q192R allele. Then how did these data inform our understanding of the increased malignancy risk observed with tofacitinib versus TNF inhibitors in the oral surveillance study? If tofacitinib increases pyroxenase activity, which in turn decreases malignancy risk, it may be that TNF inhibitors had an effect greater than that of tofacitinib on decreasing the malignancy risk among subjects in the oral surveillance study. Alternatively, more tofacitinib-treated subjects in this study might have had the QQ genotype of PON1, which is associated with lower pyroxenase activity than the RR genotype. To address this hypothesis, it would be interesting to have PON1 genotyping performed on the RA patients who participated in the oral surveillance study. This investigation links an enzyme associated with HDL cholesterol, which hydrolyzes and destroys oxidized lipids, with a reduction in malignancy risk. The observation that tofacitinib increases pyroxenase activity has important implications regarding interpretation of the oral surveillance study. Might tofacitinib actually reduce absolute malignancy risk in patients with RA? For more coverage of ACR Convergence 2021, go to roomnow.com. I'm Jonathan Kay.